Okay, good afternoon, ladies and gentlemen. Welcome to today's session. My name is Nkosilati Zulu, presenting live from Bulawayo, also at NAST as well. So I also heard there's also some people who are connected at NAST. I want to give you a shout out, guys, and thank you so much for connecting. So like I mentioned, thank you so much to everybody who took their time to connect today from across the world. Our HLF delegates, our Delta philanthropies, our fellow students and friends as well. And thank you also for inviting so many people to attend today's session as we focus on the future of work. I'm really excited about today's session as we have Dr. Marova as our special guest today. So before we get to anything else, I'm really excited about today. I know it's a bit of a chilly day, but hey, here we are because we're really excited to be sharing more information about future of work, because I understand that most of us are still at school, are still at universities, and hence we are at this platform to make sure that we get some nuggets that we can go out there and apply in real world. Okay, so before we get into our main session, ladies and gentlemen, there are some few ground rules that we obviously have to make sure we put on the table to make sure that our session is flowing smoothly with no problems at all. So the first one obviously being have a pen and paper. This is so because I understand that we could really say we understand during the session, but after some times we can forget. Hence, it is advised to have your pen and paper so that whatever information, whatever nuggets that you accumulate in the session, you could always apply in the future as well. And also another thing is try by all means to keep your mic muted unless you are given an opportunity to talk or you have a question or anything like that. So let's try to keep our mics on mute so that whenever we make noises, it does not disrupt the guest or the session in overall. And also another thing, let us try by all means to, switch off our videos as well. And that also helps us in order to, just avoid distractions during our session and just make sure that everything goes well. And ladies and gentlemen, of course, let us keep the chat box running with questions, with comments. I'd really love to see what, if there's anyone who still remembers what we learned about last week, you can just put that in the chat box as well, because we'd really love to know where we left it from and where we're going to. So for anybody that still remembers what we did last week, put it on the chat box. And as we engage, let us put all our questions, our comments, and everything in the chat box as well. So yeah, that's pretty much about our ground rules. Like I mentioned, Salibonani, Linjani, for Ama 2K City, what's up? Away, and thank you so much for joining in today. So I will be giving this moment to Gerald, who is going to take us through a moment of prayer so that he can pray for our session and make sure that everything is going well and we're in the right spirit. So over to you. Thank you so much.
Good afternoon, ladies and gentlemen. It seems like our prayer leader is not in the session, so I will take us through a moment of prayer. Let's bow our heads and pray. Holy Spirit of God, we thank you for today. We thank you for all that you have done for us and all that you are to us. We thank you for making us to be here today. We want to thank you for this session, oh God, and we want to thank you for the chance and the opportunity that you have given us for us to be here. Father, we pray that as we proceed, may your hand be upon us, oh God. We pray that may your hand be upon our facilitator, and we just pray, Holy Spirit, that we will be in the right spirit as we learn more about the future of work. In the mighty name of our Lord and Savior, Jesus Christ, we pray. Amen.
Oh, thank you so much for that prayer. And also coming through for us. I mean, these things happen where we have, some technicalities that might affect how these things work. So thank you so much to our backup prayer leader for, taking up the task and putting everyone in the mood, for at a good spirit. So, before we introduce our guest, I want to let you know he's a definitely certified medical doctor who's been in STEM for a long time, who really understands how the system works, who's been there, who's done that, and who's really been in the industry for a long time. So it's going to give us some tips, some nuggets, especially for our people in the STEM industry, but overall to everyone, because this advice will be assistive to everyone. So we have Dr. Marova in the building, ladies and gentlemen, to our aspiring doctors and our aspiring people in STEM, and just generally our aspiring leaders and people from HLF and Young and Dynamic. We are here to welcome Dr. Marova. As you can see, I'm a good student, so I have an apple here because you know what they say, an apple a day keeps the doctor away. So I'm just ready and excited to be a good student and to show the doctor that I'm reading good books and trying to be, a good student as well. So ladies and gentlemen, can we take this moment in the chat box? Let's make sure that we invite our doctor on the platform. Dr. Marova, thank you so much for attending today's session. The floor is yours. Thank you.
Thank you, guys. I hope you can see me and you can hear me. Kindly just acknowledge in the chat box if you can hear me and if you can see me as well. I'm sure people can hear me, is it? Yes, we can. Thank you very much for the lovely introduction. My name is Dr. Christian Marova. I've been a registered and qualified medical practitioner since the year 2016. It's important to mention nowadays that you are a fully qualified and registered, because I'm sure you've been hearing on the news some people masquerading as doctors. So I'm happy to say that I'm a fully qualified and registered medical practitioner since the year 2016. And at the moment, I'm working at Chitungwiza Central Hospital, where I'm a hospital medical officer in the Department of General Surgery. I also have my practice in the avenues called Mankind Clinic. Mankind is in humankind, not necessarily for men, but it's a clinic for everyone. It's Mankind Clinic in the avenues. Thank you very much, guys, for inviting me, and thank you for welcoming me. I hope our discussion is going to make sense and is going to help someone today. I'm sure our topic is about the future of work, especially pertaining to medicine. So the first point that I would want to talk about is what is medicine? Because we might all be talking about medicine, yet we don't even know what is medicine. So from my definition, I've defined medicine as an art of improving people's health, prevention of disease and complication that will ultimately lead to disability and death. Remember, I've said it's an art, because most people take medicine as a science. Yes, of course, you need to have passed your science subject. The training is almost completely scientific, but the practice of medicine at some point becomes an art. So medicine itself is an art of improving people's health, helping them to prevent diseases, and to also prevent the complications that might arise from these diseases. And the complications, we also need to appreciate that these complications will ultimately lead to death or to disability. So it is an art of improving people's health, preventing diseases, and also preventing complications that can arise from these diseases. Medicine is one of the most, if not the most selfless of careers. So if you are looking for a career for your selfish gains or for your selfish interest, I'm so sorry to tell you that medicine is not the practice for you, because in medicine is a completely selfless career, because almost everything that you're doing in your practice, it's about the betterment of someone else's life. It's not necessarily for your own betterment. It's not necessarily for your own financial gain or any other gain that we might think of. Medicine is solely a selfless career. So it's almost always about the needs of our clients rather than your own personal needs or your own personal ambitions. Sometimes you need to sacrifice a lot when you're a doctor. You might end up having to sacrifice your social life, time with your family. Maybe you've other business going on. You might end up having to sacrifice a lot of your own personal needs and your own personal requirements when you're a doctor. Imagine when you're a doctor, you could be enjoying your weekend, and before you know it, a call is coming in that there is an emergency, you need to attend to an emergency, or your admitted patient is deteriorating, you need to go to the hospital. So there is a lot of sacrifice that is involved in the practice of medicine. I always joke around with my gynecologist friends. Imagine you're a gynecologist, you plan your holiday, you are leaving town with your family. Before you cross the toll gate, you get called that one of your clients is now in labor. Imagine what's going to happen. You are going to be forced to drive back to attend to your client. So medicine is a very selfless profession, a very selfless career that might force you to sacrifice a lot. So next time that you meet a doctor, please give them a lot of respect for the sacrifices that they do for other people. So a doctor needs to be someone who is able to sympathize with your client. You need to be able to sympathize and also to empathize with your client. This allows you to connect with them, because when you're trying to make a diagnosis, when you're treating a client, almost 80% of the diagnosis comes from your interaction with this patient, what we call history taking. So when you're taking your history, you're talking to your client, that sells 80% of the diagnosis. The other things that we might end up doing, such as in lab investigations, X-ray, ultrasound scans, you name it, all those things are just responsible for about 20% of making the diagnosis. So 80% of the diagnosis, you get it from your interaction with the patient. So if you're not able to sympathize, to empathize with them, to create a good rapport with them, they will not be able to open up to you. Because if they're going to open up to you, it means they need to trust you. They need to feel comfortable with you. So you need to be able to sympathize and empathize with the patient so that they are free enough, they are open enough to be communicating their problems with you. The WHO, the World Health Organization, has defined health as a state of complete physical, mental, financial, and social well-being. So they say health is a state of complete physical, mental, social, and economic well-being, and not necessarily the absence of infirmity. So in the practice of medicine, if you intend for your patient to be healthy, these four arms have to be satisfied. Your client, they have to be physically well, they have to be mentally well, they have to be socially well, and they have to be financially well, because all these facets, they contribute to an individual being healthy. So most of us, when we think about medicine, most of us, when we think about health, we are only thinking about diseases. We are only thinking of your cholera, you're thinking of your diabetes, you're thinking of hypertension. But if someone is lonely, they're going to be depressed. So if someone is socially unwell, they are not healthy. So as a doctor, you also need to be able to understand that all these facets, they contribute to the well-being of your patient. And if one of these is not met, your client is not going to be healthy. So if you are a doctor, you need to appreciate that as much as I'm treating this diabetes, as much as I'm trying to treat this cancer, I also need to appreciate that there could be some social implications or social problems that could be affecting this patient. There could be some financial issues that could be affecting this patient and ultimately leading them to be unwell. So if we are going to practice medicine, we need to appreciate that all these facets, they contribute to the wellness and the well-being of our client. I don't know if there's anyone who might need a clarification on the definition of medicine. I'm not seeing a hand. So maybe I'll move on to the branches of medicine. So when you're practicing medicine, it has various branches. Someone is saying, I need a clarification on the financial part. That's very difficult one to talk about the financial well-being, because by virtue of you being in the developing world, third world countries, Zimbabwe specifically, most of us, they are financially aggrieved. But you know that if you are financially unwell, if your bank balance is close to zero, if you're not receiving your incomes as much as you can, you might end up being depressed. So if the financial aspect is not addressed, your patient is going to be depressed. The next is your patient is going to develop parasuicidal tendencies, or ultimately committing suicide. So if someone is coming to me after attempting to commit suicide, I might treat the symptoms of the complications of whatever method that they would have tried to harm themselves. But if me as a doctor, if I don't try to find ways and measures to facilitate the financial wellness of this patient, it means next time they are going to come in a worse state, or they are ultimately going to commit suicide or kill themselves. So if you take a look at our central hospitals like Parirenyatwa, Mpilo, UBH, Chitungwi, Zarere Hospital, if you take a look at them, we might not be functioning as well, but you're going to see that in those hospitals, we have people that are ready to assist the patients socially. If someone is not able to pay their hospital bills, we have social services as well that are there to assist these patients so that they get treated, even if they don't afford the treatment. But it's just that with our current situation, especially here in Zimbabwe, these offices might not be functioning optimally, but the foundations are there, so that if someone cannot afford treatment, we have our social services that should be there, so that they assist them, even assist their families with food, with shelter. But it's just that because of our financial status as a country, these departments are not working optimally. So when you talk about the branches of medicine, when you talk about branches, some might want to talk about the specialties. So I'm just going to run down some of the specialties and the branches that we have in the practice of medicine. Maybe some of us know in internal medicine, these are specialists that we call the physicians. So the physicians, these are the doctors that they've specialized in the treatment of non-surgical conditions such as diabetes, hypertension, hepatitis, diarrheal condition, your headaches, your strokes. These are the physicians. They would have specialized in a branch of medicine that is called internal medicine. So when you do your undergrad, especially here in Zimbabwe, when you do your undergrad in medicine, you qualify as a general practitioner, and you practice as a general practitioner. After some years, you'll be able to apply to go for MEd or for postgrad. And at postgrad, UZ offers, University of Zimbabwe, it offers MEd programs. You can go there to specialize in certain specialties. So if you're going to become a physician, you need to have specialized in a branch that you call, in a program that you call internal medicine. So on average, internal medicine is about 4 years long when you're doing it with the University of Zimbabwe. After qualifying, you then become a physician. So physicians, they are quite successful, because if you are going to see a physician here in Zimbabwe, you need to pay about 80 to 120 USD for consultation. So they are quite successful. They are almost all specialists. For you to see them, it's an average of 80 going up. So you can tell that if you are a specialist here in Zimbabwe, you can make a lot of money if you are to see clients at your rooms. But in the internal medicine, when you're now a physician, there are also some subspecialties that are there. So there are some, after qualifying as physicians, that have subspecialized in another branch of internal medicine. So you can become a gastroenterologist when you're dealing with the abdomen. You can become a respiratory physician. You can become a neurologist. You'll be dealing with the central and peripheral nervous system. The commonest condition that you'll be treating there are the strokes. So those are some of the subspecialties that you find in the branch that we call internal medicine. And then we also have surgeons. Myself, I got interest in surgery. I'm going to be specializing in general surgery. So general surgery is also a branch of surgery. So when you're in surgery, you can specialize under general surgery. You can become a urologist. Urologist will be dealing with the genitourinary system, such as the bladder, the urethra, the prostate in men, and also the kidneys. So those are urologists. You can also become a cardiovascular surgeon, whereby you'll be dealing with the heart and blood vessels. You can and also the lungs as well. You can become a neurosurgeon, whereby you'll be operating the brain and the spinal cord. Orthopedic surgeons, orthopedic surgeons are quite successful. They are quite rich in our field. Orthopedic surgeons, they'll be dealing with bones. You know, there's a lot of trauma on the road with road traffic accidents. People are always getting fractures. So when someone gets a fracture, you get treated by an orthopedic surgeon, and sometimes they can offer you surgery. So those are some of the subspecialties that we have in surgery. And then if you are interested or if you are quite passionate about young children, you can become a pediatrician. Pediatrician, they deal with young children. They're patients that are below the age of 12. So everyone who is below the age of 12 when they are sick, we refer them to be managed by pediatricians. So pediatricians, they manage children from the day that they are born. If you give birth, especially in a private hospital, you are entitled by law for your newborn baby to be seen by a pediatrician. Whether they are ill or they are not, a pediatrician needs to come to assess your newborn baby. And they will charge you about $120 for them to just come and assess your baby. Sometimes they just assess your baby for about 5 minutes, and then you have to pay them $120. So those are pediatricians. They deal with children from the day that they are born to about the age of 12 years. So that's pediatrics. And then some of us could be excited with female medicine. So those that are excited with female medicine, they can become obstetricians and gynecologists. So a lot of doctors end up becoming OBGs, which is the obstetrician and gynecologist, who deal with gynecological issues. They also deal with pregnancy-related conditions from the time that someone gets pregnant to the time that they give birth, or to up to 6 months after. If you have fibroids, if you have got vaginal discharge, if you have ovarian cyst, endometriosis, we refer you to the gynecologist. So those are some of the branches of clinical medicine. And there is also an important branch that we call pathology. So pathologists, these ones, I'm seeing someone commenting that all we are seeing are the dollar signs. I will stop mentioning the consultation fees. I see Mashanda there from NASTI saying all that we are seeing are dollar signs. Medicine is fairly rewarding, especially after you have specialized. If you qualify today, trust you me, your first few years, they are not going to be financially okay for you, because you'll be stuck in that government hospital, earning the paltry salaries. But you should not lose hope, because after a number of years, you get to specialize, you get to open your own practice, and you start making the big bucks. So pathologists, we work hand in glove with pathologists, because pathologists, they help us in making the diagnosis as doctors. So pathologists, they usually work at the labs. These are the specialist doctors that operate from the laboratories. So they deal with diagnostic investigations, which aid us in making making a diagnosis. So there are various types of pathologists. You can be a hematologist who deal with blood. You can be a immunologist. You can be a histopathologist. I like histopathologist because if we, the surgeons, if we take a sample from our patient, we send it to the histopathologist who will examine this sample, look at it under a microscope, and they will be able to make an accurate diagnosis for us. So these are some of the facets or some of the branches of pathology. So you will see that some of these pathologists, they can either work at a government hospital in the government labs, or they can open their own private labs, or they can also work for big laboratory institutions such as Lancet. And the good thing about medicine is you can be able, if you are able to manage it enough, you can get 3 or 4 salaries, because you can work at the government hospital while you're operating your own private room, or if you're a pathologist, you'll be working at the hospital laboratory, you'll be operating your own private lab, and you can also be working for the big institutions such as Lancet at the same time, getting salaries from all this. And that is the good thing about the practice of medicine. So that's pathologists for you. And then we have what you call the radiologists. The radiologists, these are the specialists that deal with X-rays, ultrasound scans, CT scans, MRI. So they deal with imaging diagnosis. If you want to do an imaging test, we refer our clients to the radiologist. Just imagine the number of patients that get an X-ray, the number of patients that get an ultrasound scan, and nowadays the number of patients that also ultimately get referred to get a CT scan or MRI scan. That's all money for the radiologist. So radiology is also a very good specialty to do if you are not interested in clinical medicine, because there are some people who want to be doctors, but they are not passionate about spending time in the hospital, cutting patients, or seeing very sick people. If you are not really interested in the clinical practice of medicine, you can become a pathologist, you can become a radiologist, or you can also become what we call a public health specialist. Public health specialists, these are doctors that are specialized in doing clinical studies. So they do clinical studies, come up with data pertaining to conditions, incidents, prevalence, and the burden of disease. And this is very important because our policymakers, our MPs, our ministers, the government, they cannot make policy if they don't have data. So if we want the government to give us a lot of money to treat, let's say, to manage diabetes, we need to present to them with the local statistics that we have about the burden of disease. And this is the work of the public health specialists. So the public health specialists, if you think about COVID, they are the ones that will be calculating how many people have been infected by COVID this week, how many people have died, and then they present this data to the relevant authorities such that policies and legislation can be made. And then you can also become an oncologist. Oncologists are specialists that specialize in cancer management. So if we make a diagnosis of cancer, we refer our patients to oncologists. Oncologists, they will administer, they will start by staging the cancer to see whether the cancer is stage 1, stage 2, stage 3, or stage 4, stage 4 being the end stage. And then they will administer appropriate treatment, which can either be chemotherapy. Chemotherapy, we're saying we are treating our cancer using drugs, or it can be radiotherapy, whereby we'll be treating our cancer using X-ray technology. So if you're an oncologist, you either be doing chemotherapy or radiotherapy, dealing with a cancer patient so that they can go into remission. And also, if it's end stage, oncologist has to be ready to be able to deal with end-of-life issues, discussing them with our clients. So those are some of the branches of medicine that I had to discuss. Someone is saying anesthetist. Anesthetist, it is a very good path. Anesthetist, I want you to think of anesthetist like as like the vouchers. If you watch a lot of National Geographic Channel, or if you're a friend of the wild, yeah, I want you to think of anesthetist as the vouchers. Let's say a lion is hunted down his prey, is caught his prey. Halfway through its meal, you see the vultures coming, the hyenas coming, and then they will take part of the meal. So that's an anesthetist. An anesthetist is always, whenever a surgeon is going to operate, they will not operate without an anesthetist. So when you're an anesthetist, you just need to have 3 or 4 surgeons that you become friends with, so that when they get their patients, when they're about to operate, they call you, and then you make your money. So you can be making a lot of money from other people's prey. That is the anesthetist. It's a very good and it's a very rewarding. And ultimately, these anesthetists, they end up becoming richer than the surgeons themselves. Because if I'm a surgeon, I might operate 1 patient a day. But if I'm an anesthetist, my 4 surgeons friends, they might call me, and then we might just schedule our surgeries at different times, so that I can be doing anesthesia on 4 different patients from 4 different surgeons in 1 day, and ultimately make more money than them. So anesthesia is also a very good path. If anyone has a question on the branch of medicine, you can put up the question in the chat box, and I'll be able to respond. Okay, so what have been the achievements in the practice of medicine? This now depends on certain geographic location. If you are in the 3rd world, there are certain things that we would celebrate as achievements, but by virtue of us being in the 3rd world, we need to realize that what we might call achievements here in Zimbabwe, in the developing countries, those things would have been introduced 10 or 20 years before us in the 1st world. But here we have been fighting HIV and its related complications for the past 20 or so years. And the biggest achievement that we have is, we are, as a nation, we are actually winning. We are actually winning our war against HIV. Right now, our government is saying we are targeting what we call the 95-95-95. When we're saying 95% of the population, it needs to be tested for HIV. And 95% of people that test HIV positive, they need to be on treatment. And 95% of the people that are on treatment, they need to have their viral load suppressed. Because what we've gathered from the latest research is, if someone's viral load is suppressed, is undetectable, it means the risk of transmitting HIV is next to none. So there is a motto that we use nowadays when we say undetectable means non-transmissible. So that's a big achievement that we have made as a country, and our incidence and prevalence, especially in relation to HIV and AIDS, has gone down because of all these policies and measures that our government and Ministry of Health has implemented. They've also been able to fight against mother-to-child transmission of HIV. So that's a big achievement that we have had. And now we have a lot of technology pertaining to diagnosis of patients, such as the CT scans, MRI scans. They are now available in the country. However, they are quite expensive for the ordinary person to get, because if you need a CT scan, depending on the region, maybe it might cost you about $300, and MRI scan might cost you about $500. So these are still quite expensive, and they are not readily available in our public healthcare sector. But we'll take it as an achievement, because these facilities are already there with us. We also have our interventional radiologists. If someone has got a mass or a cyst, traditionally we used to go to operate, but our interventional radiologists, they are now using ultrasound guided procedures to minimize invasiveness of procedures. I'm seeing a question here saying in Zimbabwe, which university offers anesthesiology? That's from Gunduza, Louisiana. University of Zimbabwe offers a postgrad degree. It offers a postgrad degree in anesthesiology. So if you graduate as a doctor, you can apply to do anesthesia. The course is about 4 years long as well. After that, you would have qualified as an anesthetist. We also have what you call nurse anesthetist. If you have your friends who are nurses who might want to pursue the anesthesia, because of the shortage of anesthetists. Because imagine every hospital in this country, be it a district hospital, first level hospital, it needs an anesthetist, but we don't have enough specialist doctors to send to every district hospital. So the government has also trained certain nurses to become specialists in anesthesia, so that they can be able to render anesthesia at the peripheries. If a woman is in labor who needs to get a cesarean section down there in Filabusi or any other district hospital, we have nurse anesthetists who are there. So if you have friends who want to be nurses, you can also encourage them that they can also specialize in anesthesia as nurse anesthetists, and they can be able to make money. And then I'm seeing Takunda Mudimu, he's saying, do all these fields really pay in Zimbabwe? For example, being a pediatrician, because you find out that people have no money and rarely visit pediatrician. You know what? The cake in the medical field, the cake is too big. Yes, I agree that people don't have money, but there are some people that have money. And those people that have money, they look for specialist services. I've never seen a specialist who will be suffering in Zimbabwe. Of course, you will not make as much as you would have wanted, as much as you would have dreamed of. But these are very successful professions and very successful specialties. So they do pay. And if you're in Zimbabwe, trust you me, if you're a specialist in Zimbabwe, and if you're a good entrepreneur, if you have a good entrepreneur mind, while you're a specialist in Zimbabwe, operating your own private practice, you might make more money than someone who is working in the first world. Because if someone is working in the first world, I've got a senior colleague of mine who is a neurosurgeon. I met him a week ago. He was telling me that he now operates 1 or 2 patients a week. He now operates 1 or 2 patients a week. And for one patient that he operates, he charges an average of $4,000 US. So imagine he's a neurosurgeon. There are some that don't pay as much. But imagine if this guy is getting $4,000 US for one procedure, yet he's operating an average of 2 procedures a week. He's getting $8,000 US just from procedures. Imagine the other monies that he gets from seeing patients at his rooms, other patients that he might see at other hospitals, and he frequents traveling to and from UK because his wife is in the UK. So after every 2 weeks or so, he flies to the UK to see his family. His family is in the UK, but he's operating here in Zimbabwe, and he operates an average of 2 patients a week. The reason why he's not operating 2 patients is because he's saying, I don't want to be too fatigued. Because if I get fatigued, I will not be able to render the best service to the client that I will be operating. So just imagine. So if you're a specialist in Zimbabwe, you indeed make money while you're here in Zimbabwe, especially in private practice. But after qualifying in medicine, the first years when you're an intern, the first years after internship, those years are quite difficult. But once you go back to school and become a specialist, trust you me, your life gets better. Someone is saying for those who studied biochemistry, if you studied biochemistry, you can also apply for medicine, and then the University of Zimbabwe and other universities, I'm sure they can offer you the program to study medicine. Or when if you've studied biochemistry, if you specialize, if you do your masters in biochemistry, you can even open up your own lab. So you can operate your own lab in town, and then you can also make money as a specialist biochemist. And then how are you making the services you have mentioned accessible to an ordinary Zimbabwean? Very difficult question by Jeffrey Jasin. These services, yes, indeed, they are available to the ordinary Zimbabwean, especially at the central hospitals. But we know that at the central hospitals, we have the specialists. Almost all the specialists that I've mentioned, they are available at the government or public hospitals. The only problem that we have is sometimes the resources that we might need to have, such that these specialists they perform to the best of their ability. Sometimes the resources might not be there. But speaking from the angle of surgery, we indeed operate almost every day. We are either operating an elective case or operating an emergency at the central hospital. So these services are indeed available to the ordinary Zimbabwean. But sometimes, you come to the hospital, we have to operate you. We might not have certain resources, and then we end up giving the relatives some prescriptions, say, go and buy these things. And our only challenge that we might have is lack of the resources that we would need to render the services. Someone is saying $32,000 a month. It's possible, Marova. It's possible. I'm telling you about this specialist neurosurgeon who are saying he's making about $4,000 from one patient, which is $8,000 in 1 week. And then Takunda Mudimu, what's your take on people who go to study medicine in Indian universities? For example, under those that scholarship, I'm sure, and those who go to Zambia, Indian University. I think our challenge that we have locally is most people who end up going to study outside the country, it's either they would have failed to get a place at one of our local universities, and this is someone who's passionate about studying medicine. So if you fail to get enrolled locally in Zimbabwe, why not try outside? Because after graduating, after working, we end up all being the same doctors, doing the same procedures, because the training is far or less the same. So if you fail to get enrolled locally, especially in the of Zimbabwe, NAST, if you can get a place at a foreign university, why not try it? But me personally, I feel our local universities, especially University of Zimbabwe, yes, I might be biased because I trained at the University of Zimbabwe. I think we offer a very good degree in medicine, in the Bachelor of Medicine and Bachelor of Surgery. But if you fail to get enrolled, why not go outside? What is an audiologist and what do they do? Audiologists, these are specialists that deal with hearing. They are not necessarily doctors. If someone is an audiologist, they are not necessarily doctors. They are just paramedics that have trained in hearing. So if someone has got hearing problems, they go to an audiologist, they check their hearing levels, and then they can offer them hearing aids or whatever. But if you're a doctor, if you want to specialize in the ear, you do a specialty program that is called ENT. So they are what we call ENT surgeons, which is the ear, nose, and throat. So the ENT surgeons, they deal with the ear, nose, and throat, and they are also quite successful. One of the most successful that we have is Mr. Chidziva. We have them here in Harare. So they also make quite good monies. But an audiologist is not a doctor. If you're a doctor and if you're interested with the ear, you do what is called ENT, and then you become an ENT surgeon. It's also another 4-year program at the University of Zimbabwe. What are the average earnings a difficult question to attack because remember I mentioned that you can either work in the government hospital, you can do locums when you're working at the private hospitals, open your own practice or work at a private hospital full time. But locally here in Zimbabwe, we know that our doctors are not well paid. But when people are always talking about doctor salaries, we are only talking about what the government is offering. But you might work for the government can pay you about let's say an average of $500 a month, but you are not in that hospital all the time. You are not in that hospital 8 to 4 or even up. You can be in that hospital only for 4 hours a day and have your holiday, have your weekend. So the extra hours that you have, that you are not in that hospital, those are hours that you can use to make more money for yourself. So you can be working in that hospital for 4 hours, and then after that, maybe you started at 8, by midday you're done, and then 1 o'clock, probably you're starting a locum at another private institution. And if you cumulatively at the end of the month, you can be making as much as someone who is working in Namibia, in other countries. So it's possible to make a 1,500 if you are still starting, or to 200 if you are lucky enough with the locums. But the government salaries here in Zimbabwe, it's about $500 a month. If you are combining the USD and the local currency, they give us partly USD and part South African doctors, they earn very well. Those guys, they earn very well. They're able to get a house on mortgage, buy a new car. And those guys, they earn quite a lot. In Zambia, I think they're earning an equivalent of $800 to $1,000, but earning it in kwacha. May you share some tips on how you maintain a healthy work-life balance as a general surgeon? It's very difficult one, Grace, to have a good work-life balance when you're a doctor, especially a surgeon, a general surgeon. But you ultimately have to try. You also, your friends, they understand your schedules. They understand how you operate. Because if you are surrounded by people who do not understand you, you always be in trouble, because they will never appreciate the fact that they can invite you for dinner, you can show up 2 hours late, or give an excuse 15 minutes before the dinner. So you need to make sure that the people around you, your boyfriend, your girlfriend, your wife, your husband, your parents, your colleagues, you need to make sure that the people around you, they truly understand your life and how you operate. If they understand you, trust you, me, you'll be able to have that life-work balance. Because be surrounded by people who understand you, by people who are supportive. Or the same boyfriend, it's very difficult for those when you're doing your internship, because you're almost always in the hospital. How do you make the best years in med school, since the life I had seems worse? In medical school, what I advise you guys, don't be at the extreme ends. Don't be that workaholic medical student, and don't be that lazy medical student. If you are supposed to do your homework, just do your homework. If you are supposed to go to the wards, just go to the wards. Because it's not a rule of thumb that the hardest working student at college is going to pass medical exams. There are some people that have failed, yet they were at the extreme end. They were always in the library. They will not see their family. They will not see their boyfriends or see their girlfriends. They would miss meals. They're at the extreme end, and then you find those people failing at the end. So don't be at the extreme ends when you're in medical school. Just do what you're supposed to do. Study when you need to study. When you need to rest. If you have to go to the wards, go to the wards. Make sure that your consultants in the wards, they know you. Because when you do those clinical exams, when you walk into that room, if they recognize your face, if they remember you, it means they are going to be nice with you. They are going to be lenient with you. They are going to be understanding. Because what the consultants don't want at the end of the day, they don't want to pass someone who was not coming to work, someone who was not coming to school. So don't be at the extreme end. Don't be that lazy student. Don't be that one who's always studying, never has time to play. If you're going out with your friends, go out and come back and study. If you're going to church, go to church and go and come back to study. That's the advice that I would give if you are at school. Okay, I'm about to finish. Let me talk about technology and AI. I'm sure that technology and AI, everyone might think that our profession in the coming few years will be under threat, and doctors will not be very important and very necessary, because with technology nowadays, it has become easier for us. It has become easier to make a diagnosis, or I'll just, even when I'm a doctor, I'll just type in a few symptoms, and then Google will be giving me a list of possible diagnoses, which makes it easier for me as a doctor. Makes it easier for me as a doctor if I want to refer for the appropriate dosage for my patient. I can also make use of technology. So it has also become easier for us in making a diagnosis, in making early diagnosis, and also rendering early treatment to our patients, especially if you think about cancer. But the CT scans that we're talking about, the endoscopies, all that's technology. So technology has actually helped us to be where we are today. But we also need to appreciate the fact that technology is not ending here. Technology is going to continue developing, especially with AI. So it's going to be much simpler for our patients to self-diagnose with AI. And AI is going to offer our patients treatment even while they're at home from their gadgets. And we also talk about robotic surgery. Very soon we are going to have robots operating in place of us, the surgeons. So robotic surgery has also been talked about, but it will be very effective for us in rendering treatment for our patients. But it will never substitute the doctor. It will never substitute the empathy and the sympathy that I was talking about earlier on, because you need to be empathic. You need to be in the relationship with your client, so that you're able to make a diagnosis, so that your patient trusts you and they continue coming back to you. So I don't think in the future our jobs will be at risk. However, artificial intelligence technology is going to help us in making early diagnosis and treating our patients rather than taking over our jobs. I see that's true. Thank you, Grace, for that reassurance. So for the current students, I encourage you not to be discouraged by the current prevailing salaries that we are earning quite well. They will borrow from them. So we only hear of the minimum wage that our doctor colleagues are earning. So you should not be discouraged by the poor salaries that you hear that doctors will be earning, because it's just for the first 2 years or so. Afterwards, you'll be in private practice, and the profession is a quite rewarding profession as well. And you need to get a good mentor. You need to get a mentor who will guide you through school. Get a mentor who will guide you through school, and after you qualify, you still need a mentor who will guide you through the career. So get a good mentor. And then my advice to the students as well, they also need to appreciate the fact that medicine has never been an easy program. So if it's hard for you today, just remind yourself that it has always been a difficult program. Even for me, it was a difficult program. Even for my seniors, it was a difficult program. So whatever challenges that you are facing today, it doesn't mean that it has started with you. So all these successful doctors we see ahead of us today, they they also struggle through medical school. But the good thing is almost everyone who starts medical school, if they don't give up along the way, they will pass their final year and they will qualify as doctors. You might fail, you might repeat a year, but ultimately you pass. Almost everyone who starts medical school, if they don't give up, they will qualify as doctors. So my encouragement to everyone who's a student right now, the moment that you start medical school, if you choose not to give up, you will definitely qualify as a doctor. So sometimes you cry yourself to sleep, but you should never give up. If you have never cried as a medical student, it means you haven't started. At some point, you will cry. Either in first year, second year. If you haven't cried before final year, trust you me, in final year, you will share a tear one night. So everyone will cry at some point. But take this as a matter of encouragement that we will all finish and we will all graduate and we will all become successful doctors. And also, do not compete. I'm seeing people that are laughing. I'm sure all these guys have cried at some point. And when you cry alone in your bed. Almost everyone at some point will shed a tear in medicine. So if you've ever cried, just know that you are not alone. Everyone is crying, but people will cry in privacy. Also, do not compete with your classmates. The competition for prizes ended in high school. In university, especially in medical school, do not compete. Even us as doctors, we never compete. I had a client just this morning who called me. I was supposed to operate him. I charged him a good amount. He came to me just because I was a bit busy. I called my colleague to be operated. He has got all his monies. I gave my colleague the patient, and they operated, and my colleague got the money. So you should not compete in medical school. Even in practice, you should not compete. The years of chasing the prizes, the years of chasing the accolades ended in high school. But here we share knowledge. We try as much as possible to improve each other. If someone is not doing so well, you give them advice, you give them the knowledge. You should not celebrate when your colleague is down, because they might be down today, but tomorrow you'll be the one who will be down. So you will never know everything as a student. You will never know everything. You will never know everything about medicine. Even as a specialist, you could be a neurosurgeon, but while you're operating, you might encounter something that will require you to call a fellow neurosurgeon to ask for advice or to ask for a hand. So you never know everything. Even as a specialist, imagine, I'm saying a specialist, you're saying you have specialized. You are the guru in this field. But even as a guru in that field, you never know everything. What more as a medical student? What more as a high school student? You will never know enough. So get those group discussions, share knowledge. If you identify or discover a case that you think your colleagues have not encountered before, share that information with them. See that patient together so that we all learn together. So even after qualifying, just remember that you will never know everything. If you are not sure of something, call for help, ask your friend for advice, and we will all become better at the same time. How best can the doctors be assisted in Zim by this illegal practice of buying drugs and medicines without prescriptions? I'm reading from the chat box. Yes, we know that there's a lot of unethical things that are happening, especially in private practice. People get drugs from Zambia and other countries that are a bit cheaper. However, they will not be registered locally. When you qualify, I do encourage you that just try to practice medicine ethically. Just try to do things the way that they should be done. Just try to do things the right way. If you identify that some people have been making money unethically, yourself, you need to make your own decision that I'm going to stand by my principles. Because if your client realizes that this doctor of mine is a principal doctor. They will trust you with their life. And when they trust you with their life, they will recommend you and they will continue referring people to you. So I appreciate the fact that there are a lot of unethical things that might be happening, that you might be hearing about, but it's not as prevalent as you might hear. There are some people that are doing things right, that are doing things ethically. So you as individuals, you need to make that conscious decision that even after I qualify, I'm going to be practicing ethical. And you start as students. Even as a student, you don't need to buy exam papers. If other people are telling you that we have a cadaver from the exam, of the exam, we are studying the exam paper, make your conscious decision that I'm going to pass ethically. Because if you qualify unethically as a student, you are also going to practice unethically as a doctor. I don't know if someone else has a question before I finish. There are 5 new messages there. Someone is saying, I'm learning. How can I get a mentor? What I'll do, I will share my email. I will share my email with you guys. And I'll also share my Facebook page handles and Instagram with you. We can become friends. We can create a community. We can always discuss. So I'll share my email with you. I'll also share my Facebook and Instagram handle. I'm also on TikTok. Those that love TikTok, we can we can link up on TikTok. I post a lot. I post a lot of medical issues on TikTok because I also do TV shows with 3K TV. I also do ZFM and Capitalk radio shows. So sometimes I post what I do on these platforms. So I'll share the handles. I'll share the handles in the chat box just now. And then to the high school students, before you choose your program, do not choose medicine because you want to impress your family or your friends or your community, especially these guys that get 15 points, 20 points, because these guys, they qualify for a lot of programs. They end up choosing medicine just because they want to impress their families, because everyone thinks that if you're the brightest student in high school, you need to do science subjects, and then you end up doing MPC or 4 or 5 subjects. If you do well at A level, everyone thinks that the best students go to do medicine. No, you don't necessarily need to choose medicine because of that. So make sure you understand your passions. Make sure you have a vision of your own life. You understand your values and your purpose, and see if these things are in line with this program that you want to choose. See if these things, your values, your passions, your purpose, see if they satisfy the program that you're about to choose in medicine in this question. So before you choose your program, identify your values, identify your passions, and also know a bit about the program. As we are doing now, we've discussed about medicine. So understand the program that you're about to choose before you make the decision, and do not choose because you want to impress your friends, the community, and your family. Because when you're a doctor, everyone is just saying, "Hi Chiremba, hi Chiremba, hi Chiremba." At churches, everyone just saying Chiremba, Chiremba. And the moment that some people call you doctor, they expect that you have money. Guys, there's nothing as demotivating as people calling you doctor when you go to a funeral, when you go to a wedding, or when you go to a church gathering. Everyone will be coming to you saying Chiremba, doc, and they'll be expecting that you have money, yet you don't have money. So make sure you choose the program wise. If you're choosing for the sake of money, medicine might not be the best for you, because the money might come, but the money comes late. But the dog is broke, as Mashanda is saying. So ask yourself, will you be happy treating a patient before you choose medicine? Ask yourself, will you be happy treating a patient even while you are broke? Because there so many days that you are going to be broke, especially when you are still starting. So ask yourself, are you going to be happy as a doctor? Waking up at 3 a.m., waking up at 2 a.m. to go and assist a client that you don't even know. A client who might not even say thank you at the end of the day. Most of our clients that we treat, after all the sacrifice that you did, that you do, they might not even say thank you. Some of them might operate them, manage them for weeks. They will not even remember your name or ask Naichiremba, what is your name? They will not even care about you. The relatives will not even come to say thank you. So are you ready to wake up at 2 a.m. to go and save the life of someone who will never remember you, someone who will never say thank you, doc? So before you choose the careers. Those are some of the things that you need to think about. And remember, worldwide, the world over, doctors are not the highest paid profession. Doctors are not the richest. Doctors are not the highest paid profession. If you want a lovely office, if you want to be wearing beautiful suits, three-piece suits at work, maybe try to be a lawyer. Maybe try to be something else. Doctors are not the highest paid professionals the world offer. So make sure you choose well before you choose medicine. But as I have said before, it is a rewarding profession, both financially and value-wise, passion-wise, and purpose-wise. It is very rewarding. So I'll leave this floor to any questions. If there are any questions, I think I'm done with my presentation. If there are no questions, I will leave the time with the host.
Wow. Okay. Thank you so much, Dr. Marova. This was a very amazing session. I feel like people really learned a lot from the session. And, I just really noticed a lot of engagement when you started talking about boyfriends and girlfriends. I mean, you're talking to young people, so that's what they like to hear. And, as I was enjoying the session, there's one thing that, there's a lot of things we talked about, but there's just one specific thing that you mentioned, and that's really stuck in my head. I even wrote it down. You said, you will cry at night. There's just that one day where you will cry. And honestly, it's actually might be true, and I just hope whoever takes on this road knows that there might be difficulties in the future, but overall, the fact that you assured them that if they stick to ethics, if they stick to what they want to do in life, they will definitely graduate, and they will be definitely good doctors who practice proper ethics. So, thank you so much for your time, Doctor. You also mentioned that you also provide your information on about your Instagram, your Facebook page. I'm hoping you also type in that in the chat box as well. But besides that, thank you so much. We'll definitely make sure we reach out to you when we have problems, and we'll stay eating our apples so we stay healthy, because the prices that I heard you quoting there were really high. So thank you so much for your time. We really appreciate it. And I'll just, take a minute to pray, just to say thank you to God as well for a successful session. So let us close our eyes and pray. Dear God, thank you so much for the amazing session. Thank you for your love. Thank you for your patience. Thank you so much that the network was good throughout. And thank you for the nuggets that we received today. As we finish the session, we pray that everyone who's who's connected through this platform is blessed and has a continuous and successful day after this. For those that connected in groups, I pray that they also live well and arrive at their home safely. Thank you so much, Father. In the mighty name of Jesus Christ, I pray. Amen. So yeah, thank you, Dr. Marova, for your time. I appreciate it. And I will also have one or two announcements from the office. The first one is that dynamites are encouraged to log on to the global intercessors to pray for their life and country, because prayer is very important, and we're advised to continuously connect to the global intercessors platform as well. And also another announcement is that global intercessors is looking for volunteers who can man the platform. The dynamites are encouraged to register so they can be trained. The registration link will be sent in our WhatsApp groups as well. So these are the announcements that have been given to me. I just hope everyone today from the session has an amazing day, and I pray that all of you take care of yourselves. It's a weekend. For those who are going out, take care of yourselves. Be safe and don't forget to pray. Cheers and goodbye.
Baby wami ngikutshele funa ungizwe ayafana majele